Rectal palpation is a technique that should only be used after appropriate training, because rectal tears can be fatal in this species. After copious lubrication of the gloved hand, the rectum is cleaned and the anterior margin of the uterus is grasped as shown. Gentleness and patience are very important. No attempt is made to retract the uterus, as is done in cattle, although the tips of the uterine horns can be pulled back gently to access the ovaries. Depending on rectal tone, the architecture of the ovaries is palpable to a greater or lesser degree. In many mares, rectal tone will prevent total palpation of the ovaries. This is one of the reasons why ultrasound is so valuable in mares. The outline of large follicles can be felt, but luteal structures are virtually impossible to feel because of the thick tunica albuginea around the ovary. The ultrasound examination is only done after the tract has been examined by rectal palpation. Here, the transducer is moved over the dorsal surface of the uterus from midline to the left ovary and back to the right. Often this is repeated several times until a thorough examination of the tract has been done. Here is a cross-section of the ovary showing a large preovulatory follicle about 5 cm in diameter. And here is a cross-section of the uterus. The black radiating areas are sections of edema in the endometrium, typical of a mare in estrus. Although this operator is sliding the transducer along the dorsal surface of the uterus, it's often better to apply the transducer to the cranial dorsal surface of the uterus, using it to pull back on the horns while they're being examined. This provides close contact between the transducer and uterus and provides excellent ultrasound images. It's important to examine the whole of the uterus, especially for the detection of twins at 14 to 16 days. After the uterine horns have been examined, the transducer is withdrawn slowly and rocked from side to side to examine the uterine body, the cervix, and finally the cranial vagina.